So Dr. Smith, if I'm a patient who just went through bariatric surgery and I'm also someone who has been diagnosed or suffering from sleep apnea and have a CPAP or a medication, all that kind of stuff, if I'm feeling better, should I continue using it, stop using it? What should I do?
That's such a common question. I have a lot of patients who have sleep apnea because it's an obesity-related medical problem. And what we know is that patients who treat their sleep apnea with a CPAP machine have a lower risk of death after surgery. In fact, patients who come to me with sleep apnea that's untreated, we work very hard to get them to treat their sleep apnea with a CPAP machine and to continue to use that after surgery. Patients who don't use their CPAP machine after bariatric surgery have a very low but increased risk of sudden death. And we think this is because we've cut into the abdominal wall, so that hurts, and people take smaller breaths. Then we give people pain medication, which also makes them breathe less, and then it all compiles together to result in sudden death.
That makes sense.
This is an uncommon problem. I've never personally had a patient die that way, but there is a study about it, and that's why we do it that way. So if you have sleep apnea, you're using your CPAP machine, that is great. You need to continue to use it. And we will eventually have you retested for sleep apnea and see if you can come off of it safely.
Do a lot of your patients come off of it?
They do, yeah. We usually retest people around 1.5 years after surgery.
Hey folks, connecting with your benefits is our primary mission, and theSITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.